floats around me, keeping me safe and sound. And when I fall, you tied a rope to me. You're blessing me every day. I was down with an illusion, like a sparrow with broken wings. But now I shine with your reflection on me. I'm getting back up on my feet. That you showed up was written in my palm. You are a statement, explode like a bomb. I get to push myself to victory. You make me winner. You cut me loose and set me free. You make me win in every way. You showed me how to spread my wings. Yes, I'm the winner of the day. You cut me loose and set me free. You make me win in every way. You showed me how to spread my wings. Yes, I'm the winner of the day. Yes, I'm the winner.
So the power of family planning is agency for women. It's choice for women. It's control. It's autonomy. When you've got that tool in your hands, you can do so much more. I believe that women can do so much more if they're supported, if they've got the tools, if they exist in an environment that enables them to do just that. And family planning does just that.
The power of family planning is the power of choice. The power to choose whether and when to become pregnant is key for women and girls to claim their fundamental right to bodily autonomy.
And when I fall, you tied a rope to me. You're blessing me every day. I was down with an illusion, like a sparrow with broken wings. But now I shine with your reflection on me. I'm getting back up on my feet. That you showed up was written in my palm. You are a statement, explode like a bomb. I get to push myself to victory. You make me winner. You cut me loose and set me free. You make me win in every way. You showed me how to spread my wings. Yes, I'm the winner.
Hello, everyone. Good morning, good afternoon, good evening from wherever you're joining across the globe. Thank you for joining us today and today's webinar, Ingenuity Fund, Youth's Groundbreaking Solutions to Today's Family Planning Challenges. It is great to see so many people joining from around the world. I'm really excited about it. And before we get started, I would like to cover a few administrative elements. First, this webinar will be recorded and the recording will be available on the 120 under 40 website. Second is we have simultaneous French interpretation provided for this webinar. So all you need to do, if you like the French interpretation, is please select the French language button at the bottom of your screen in the Zoom toolbar. Thank you. Again, I would like to thank everyone for joining us. My name is Margaret Bolaji Adebola. I am the Executive Director of Stand With a Girl Initiative in Nigeria. I am also and proudly a 2020 Ingenuity Fund winner. The mission of World Contraception Day is to spread the word and raise awareness about contraception and safe sex. World Contraception Day was launched in 2007 by Bayer and takes place on September 26th every year. It is an annual worldwide campaign to improve awareness of contraception and to enable young people make informed choices on the sexual and reproductive health and rights. In this webinar, we would hear from our 120 under 40 Ingenuity Fund winners about how they have applied innovative thinking and problem solving to address challenges around contraception, sex education, and sexual and reproductive health. As you may know, 120 under 40, the new generation of family planning leaders, recognizes and highlights the achievements of next generation of family planning leaders worldwide. Launched on World Contraception Day in 2015, 120 under 40 shines a light on the positive distractions made by young leaders in family planning, enabling others to model their behavior and build on their success. This multi-year project is led by the Bill and Melinda Gates Institute for Population and Reproductive Health with support from BAE. In 2019, the 120 under 40 Ingenuity Fund was launched to provide funding to 120 under 40 winners for creative and innovative solutions to family planning and reproductive health. The 120 under 40 Ingenuity Fund aims to galvanize winners to think big and bold about family planning challenges. Since then, the Ingenuity Fund has supported 15 groundbreaking projects across 10 countries. Today, I am excited to present to you our 2021 Ingenuity Fund winners and their projects. The 5 projects you will hear about in this webinar all implement creative thinking and problem solving around the future of family planning and to make positive distractions in the field of family planning and sexual and reproductive health and rights. Projects address unique challenges in contexts around the world in the area of sexual education, arts and film, knowledge sharing, and barriers to access. We will first hear from all of our 2021 Ingenuity Fund winners about their projects, including their successes and challenges. We will then open the session up for live question and answer where you, the audience, can ask panelists more about their work. As we go through the presentations and hear about the amazing work our Ingenuity Fund winners have been doing, please use the question and answer feature in Zoom to send in your questions, and they will be asked during our live question and answer. So please feel free to send in questions throughout the session. We're expecting them. I would like now to welcome our panelists, Joshua Dilawar, Maia Freundenberger, Simon Manga, Barwani Msiska, Nissily Mushani, and Sadia Rahman. Welcome, everyone. I will turn it to Joshua to tell us about his project, Marie Awas, which means my voice, giving voice to voiceless people to be heard. Welcome, Joshua.
Hi, everyone. So my name is Joshua Dilawar, and I'm from Pakistan. I'm from Institute for Social and Youth Development. In Pakistan, we have around 68% of the total population under the age of 30. If we even add the 30th year, it becomes 70% of the total population. But the young people in Pakistan, they lack information and education and knowledge around reproductive health and rights and family planning. Unfortunately, young people, they don't know about their health. They don't know about their family planning dynamics. They don't know how to plan their families. So Institute for Social and Youth Development is implementing a project in which we are focusing young people who are differently abled. And even that category, we are engaging young people who are deaf and who are hard of hearing. So we are trying to create a space for them. The project title is Meri Awaaz. It's a local word. It's a local language word, basically, which means my voice. So we are trying to give the voice to voiceless people. We are trying to be the voice of voiceless people in Pakistan. We want them to believe that they do have the presence in the society. We want them to believe that they do have a voice in our society, even if they cannot speak, even they cannot, participate through their voices. But they do have equal right to be participated. They have equal right. They have equal, meaningful participation, right? That's why this project is being implemented for the very first time in Pakistan. And fortunately, ISYD is implementing this project for the very first time in Pakistan with the support of Gates Institute, Bayer, and Pathfinder. Fortunately, in Pakistan, we also collaborated with UNFPA Pakistan to implement this project. In this project, we recently conducted a workshop with the deaf and hard of hearing young people in sign language. That was quite inspiring for us as well, because this is quite new for them and for us as well. So we conducted the whole workshop in sign language. We informed and we conducted different sessions that are related to gender equality and reproductive health and rights and family planning dynamics. That was so inspiring. And this project is quite innovative because we are establishing a comic book for the very first time in Pakistan based on gender equality and reproductive health and rights. Along with that, we are also making animated videos for sign language, in sign language for deaf and hard of hearing young people. We will be doing and we will be sharing the videos and other material with the organization and institutes who are engaged with deaf and hard of hearing young people and who are giving them education as well, so that they may also include such material so that they may teach the reproductive health and rights information to them as well. This project is quite innovative, and we are trying our best to serve the society and to ensure no one is left behind. And till now, as I have shared the accomplishment with you, so we are trying to scale up the project and to do more with the deaf and hard of hearing young people, because they are also quite interested. We found a lot of passionate young people who cannot speak, but they have the potential. They have the passion to be the change agents in the society. So that's what we are doing. And in the future, we are also planning to conduct the storytelling sessions in the society with deaf and hard of hearing young people in sign language based on different thematic areas, so that they may learn more and more about the society, about the challenges, about their bodies, about their reproductive health, about the family planning rights, and how they can plan their families in future, and how they can face the challenges they have right now in regards to their health. So this is what we are doing, and we will be doing this project, and we are trying our best so that we can engage them and we can enable them, so that they don't feel that they are left behind in the society. They have the equal right in the society to live the life the other are doing, right? So thank you so very much, and let's keep up the good work. Thank you so much.
Thank you, Joshua. Our next presentation now comes from Maia Freundenberger with a project in Madagascar. Welcome, Maia.
My name is Maia, and I live and work in Madagascar. I'm the founder and executive director of an organization called Projet Jeune Leader. Our vision is to bring comprehensive sexuality education to adolescents across Madagascar, driven by demand from local communities. So comprehensive sexuality education, which is more easily referred to as CSE, so we're going to go with that, helps advance family planning and reproductive health by equipping young people with knowledge, attitudes, and self-efficacy to lead healthy and productive lives. For widespread impact, CSE can be delivered to kids and to teenagers in school, and that's the place where this age group already spends most of their time. But around the world and at all levels, there are a lot of concerns and misconceptions towards in-school CSE, because at its core, CSE is about sexuality, and sexuality tends to be a sensitive and pretty much morally charged topic. Since 2013, Projet Jeune Leader has integrated and expanded CSE into schools in Madagascar. We recruit, train, equip, manage, and pay young adults as specialized educators to deliver CSE full-time in public middle schools, most of which are in rural, hard-to-reach areas. When I received the 120 Under 40 award in 2017, we were working in 12 schools in one region of Madagascar. This upcoming school year, Projet Jeune Leader will be working in 148 schools across 3 regions of the country. We have initial evidence that suggests that our young adult educators have unique brand power for creating support for CSE among parents, teachers, and school officials, some of whom are otherwise hesitant about the concept of sexuality education. Through this Ingenuity Fund project, we wanted to dive into this further and really think about, through an innovative and participatory research methodology called collaborative filmmaking, when, how, and why Projet Jeune Leaders young adult educators influence public support for CSE in their communities of work. Collaborative filmmaking is a research method developed by Dr. Sarah Bauman and Dr. Jessica Burke at the University of Pittsburgh School of Public Health. And collaborative filmmaking trains participants as filmmakers and collaborators, from the initial generation of ideas to answer the research question through data collection, analysis, and then dissemination of findings. This method is very useful when you're thinking about sensitive health topics and trying to provide a nuanced insight into complex practices, relationships, and spaces that could otherwise be difficult to capture using other existing research methods. Film can also serve as a powerful advocacy tool, raising awareness and encouraging social change on key topics. In the first 6 months of this project, 12 educators completed training as collaborative filmmaking researchers. These participant researchers then recorded, edited, and produced their own films in their communities of work to show through their eyes and through their vision how they influence public support for CSE. Our team then led individual co-analysis sessions with each educator, followed by a group co-analysis session to begin to understand the different pathways to creating community support for CSE. So at this point in the project, we're starting to analyze all this data, from the films that the educators created to the individual co-analysis sessions and the group co-analysis sessions. But we're already starting to find some key themes that are starting to emerge. At this point, and again, more details will be coming, we're seeing that Projet Jeune Leader educators amplify support for their work by establishing trusting and meaningful relationships and creating positive experiences of comprehensive sexuality education for students, parents, as well as community members. And this is really exciting for us because very few research exists on how to influence public support for comprehensive sexuality education. There is some research that exists, but it's looking at opposition and misunderstandings and why those exist. And that research shows and posits that this misunderstanding and this opposition exists because people do not have enough facts and evidence about CSE's effectiveness. But what we're trying to look at through this Ingenuity Fund project and what we're seeing through the data is that maybe a new strategy is needed to get people to meaningfully change their opinions on social issues that are considered sensitive, like comprehensive sexuality education. And we're finding that this strategy needs to be based on relationship building and lived experiences, and not just about facts or information sharing about CSE itself. In the final month of this project, our educators are going to go back to their communities to share their films. And this is a very important step because it's going to allow us to validate our findings and also collect and respond to community feedback about the films that they worked on. We hope that this project will shine a light on the positive disruptions of young adult CSE educators in Madagascar to address a global knowledge gap about influencing public support for comprehensive sexuality education. We also hope that at Projet Jeune Leader, we will able to harness and amplify the best practices that our educators found to continue to expand and institutionalize CSE across Madagascar, ensuring that all Malagasy youth can reach their full potential.
Thank you, Maya. Really, really amazing work that you do in Madagascar. The next project we will hear about is from Simon Manga, with his project Use of Peer Leaders to Overcome Barriers to Family Planning Access and Usage Among Female Sex Workers in Cameroon. Welcome, Simon.
Yeah, my name is Simon Manga, and I'm based in Cameroon. I'm a reproductive health specialist. I work for a faith-based organization, one of the largest faith-based organizations in Cameroon, called the Cameroon Baptist Convention Health Services. And currently, I work as Deputy Director for the organization in charge of clinical services. But away from that, my major work has been research and clinical care. Research in the domain of women's reproductive health. I've been doing work on cervical cancer prevention and family planning. So briefly, that's what I can say about myself. My Ingenuity project is titled Use of Peer Leaders to Enhance Family Planning Uptake Among Female Sex Workers. Now, female sex workers have the highest need, or the highest unmet need of family planning, not only in Cameroon, but in most of Africa and probably worldwide. Because when we look into the literature of female sex workers and induced abortions, it's very, very high. And this is just because they don't have access to family planning. And so in my Ingenuity project, my thought was how to carry family planning to the doorstep of these female sex workers. You know, we have family planning clinics all over, and we expect that everyone will come to the hospital to access these services. But for one reason or another, female sex workers may not feel comfortable leaving their areas to the hospital to get family planning services. Sometimes they are not even aware that some of these services exist. So I thought that if we carry family planning services to right to where they are, right to where they work and where they live, they are going to accept it. And my first thought was using their peer leaders, because in Cameroon we have different hotspots which are led by peer leaders who are also sex workers. And so my first thought was, if we train these peer leaders and empower them to be able, like agents of family planning, to be able to do basic counseling and even to provide sub-methods and to refer their peers for other methods, it's going to work. So that is the model that I've been piloting. And the major challenge that I've had is that of funding. The project that I designed was beyond the allocated funding. I got just 10,000. No, it's not just, it's huge. I really appreciate, yes, the $10,000 for that project, but just I was not able to meet my needs. But fortunately, I applied for one volunteer, a US couple, they call them Dr. and Mrs. Tom and E.T. Wealthy. They are based in the US. They have been volunteering with the CBC Health Services, with our work in family planning, in reproductive health here in Cameroon. And they have accepted to support the project. So they have donated an additional 5,000 to this project, and that is going to give a great push, yes, for this project. And I'm so grateful for this additional funding. Yeah, so we have the training already. We have done the training. We have trained the peer leaders in one town in the capital city, that is Yaoundé in Cameroon. And we have trained 7 of them. And they were so excited to receive this training. And they are so committed to carry family planning forward. And we did the first part of the field work, where they were, because of limited funding, we said they should enroll, because now we have 2 types of methods, the long-acting reversible contraceptives and the short-active method. So here we are providing the long-acting reversible contraceptive at an organization called Horizon Farm. This Horizon Farm is an organization that caters for the female sex workers. So instead of asking them to come to our hospital for the long-acting methods, we prefer to say that they should come to Horizon Farm, where they are used to the environment, they are used to the people, and we provided the long-acting methods to them right there. And these were the implants. The implants, we had Implanon and Jadel, and the IUD, which we have the Copper T 380A. So these are the methods we advertise as long-acting methods for these women. And we commission every peer leader to bring 10, to refer to just 10 sex workers for the long-acting methods. And this went on so well. Within a week, just few days, all of them were able to come with their 10 sex workers, and they received the long-acting methods. And at the same time, we had empowered the peer leaders to be able to provide short-acting reversible methods. For example, Sadia Press. Sadia Press is an injectable or it's a subcutaneous DMPA, depot methoxyprogesterone acetate. You know, for several years, we have been using the injectable, which is the intramuscular. But of recent, we have this subcutaneous injection, which a woman can even self-administer. So we train these peer leaders on how to administer these. And we also train them on contraceptive pills and then condoms. So we provide them with these methods, and they go around the hotspots supplying the methods. But for those who needed the long-term methods, like the implants and the IUDs, they will refer to us at the Horizon Farm, where we have successfully, within a couple of days, administered the long-acting method to 70 of these female sex workers. So briefly, that is where we are. And our next step will be to do a focus group discussion. When we did these family planning methods, we administered a questionnaire, a pre-test questionnaire for the sex workers, what they knew about family planning. And this questionnaire was administered by the peer leaders before giving the education, before giving the counseling and the methods. So we also tested them for pregnancy with the urine pregnancy test to ensure that they were not pregnant before receiving the method. So in 3 months, we are going to get them back. We are going to administer a post-test to see the knowledge difference between the pre-test and now that they receive counseling and they receive the methods. So we are going to do that as a focus group, and we say each of the 7 peer leaders will come with 1 sex worker. So they are going to choose the best among their cohort, and we are going to sit and have a focus group with them. And we are also going to repeat the pregnancy tests in 3 months, just to be sure that nobody got pregnant after receiving the contraceptive method. And at the end, we are going to also do a focus group discussion for these peer leaders. We want to find out their challenges, their experience of becoming agents of family planning among their peers. And we are hoping the objective or the bigger goal is that we'll be able to come up with a model. We'll be able to design a model to use peer leaders as agents of family planning among female sex workers. So briefly, that is the project which I've been working on here in Cameroon.
Thank you. I want to take a quick pause to remind everyone to please drop your questions in the Q&A box as the youth leaders share their projects. And our next presentation comes from Barwani Msiska and Nissily Mushani with their project Sex, Narratives, Choice, Where Do I Fit In?
Right, thank you very much. My name is Nissily Mushani, and for our Ingenuity Fund, we actually, together with my colleague Barwani, she will actually come in and introduce herself. The work that we're looking at, this is focusing in Malawi. We actually designed our project to be working with adolescent and young mothers in the peri-urban area in Lilongwe. That is the central region Malawi, but that is also the capital city of Malawi. The reason we actually thought about this is that when you look at Malawian young women, adolescents, the young mothers, they've already initiated sex at this point. Actually, the sex ed in Malawi is also at a very young age. But usually when it comes to sex education, but also their sex experiences, usually it's full of negative experiences. But also it shows that most of them, they would actually initiate sex, but they do not understand what sex is, but also issues to do with sexuality. So our program actually wants to work around that. Of course, we have sex education, which is being provided, but then the part that most often is not talked about is about the sexuality, but also the pleasure linked to sex. Usually this education will be about, if you have sex, this is what is going to happen. Usually there's that just negative messaging around it. Over to you, Barwani.
So as Nissily was talking about it, I think just to emphasize some things is that whenever part of our program or our project is really asking the question is, within the sex and the narrative and choice, where does the pregnant and mothers who are adolescent girls fit in? Because we find that every time you table a conversation around sex, choice, and the story, they're always centered to, you shouldn't have, this is a burden, why did you? Where is your agency? Why didn't you act? It's always that society is looking down at it on a blame. And when we look at young women that are peri-urban, so peri-urban is unique in its nature because these are people that are in urban areas, but that are highly densely populated and they're underserved. And what we see is these are the same girls that 1 out of 6 become pregnant before they're 16, but also that nearly in 1 of every 5 births is a repeat birth. But however, even when we look at this, I think sometimes as people who can share experiences, we only look at the figures, we don't understand the underlying factors. And recognizing, as Nissily said, that Malawi in the past couple of years has looked at its comprehensive sexuality education and asked itself to say, is how it's designed, making sure that young people have the skills to pause, to ask themselves to say, yes, I can have sex, but how do I come to have sex in a way that I can decide that is when I want to have it? Is it pleasurable? How do I make it more pleasurable? How do I negotiate sex? So these things have been like stakeholders have put into them. But I think what we find that is a gap is that given that this population there's a spotlight here, and this is also coupled for issues like around gender violence and HIV, and they have the highest need to want to use contraception, but they're not using it. So I think the question we had is, we see what the impact is, and we've worked and we've seen the gap, but how do we build in almost the momentum that's already there to make sure that as we do, we adjust the path, but that we let the adolescent girls and young mothers who are either pregnant or have a child to really say, we think if we could pause when we're doing CSC, or if I knew this is where we'd start, would help. So I think that's why the question or the guiding is a learning moment, and also to ask to say, do young women see themselves when we talk about comprehensive sexuality? Where do they see themselves? Where would they like to ground it? And how do we change that to start from a pleasure-informed approach and it be positive and not it be negative? So I think if we were to look at the driving force of our program, that's what drives this. But also to, as adding on, we said, from conversations we've had with adolescents and young mothers, it's also the stories that accompany their experience are always told from third person, fourth person. So there's a way in Malawi where, I'll say this in vernacular and then I'll explain it in English. It says, warenga mimba, amupata mimba. What that means is you have taken pregnancy, or you've been, well, the word is, I'm not translating this right, but in short ways, it says you've been given. So it's almost assumes, like it blames the adolescent or young girls. But the point is, if you are an adolescent or a young woman, are we right in defining somebody for the choices we do not understand and for the circumstances, but we're not looking at who was involved on the other side? What was the environment? What could have stepped in? What could have changed? And then we've also seen adolescent girls and mothers like come on the front line, demonstrate what kind of support would be needed and would be tested. And we thought we could come together with them to do this at a scale where we bring other partners who have been invested in CSC, so that the lessons we learn from our work do not only inform our work, but actually inform stakeholders that we can work in the health sector and health delivery, but also those who do CSE with targeting with adolescent girls and young mothers. And one of the things we also want to see beyond then is that these are the decisions they can make from an informed place that they want to jump in. Because the fear and things we've heard is you people come in and you talk about contraception, but maybe the contraception, the first time I linked to it, I was being forced by my parents because they said I got pregnant when I was younger. So this was a forced experience. Or my first sex wasn't a pleasurable experience. So how do I jump to contraception when we've not resolved the issue in between? But also, just the peri-urban is characterized by sex being a taboo, discussing and knowing the body. So for this project, we wanted to go down to start at the best. I think sometimes we only look at the end and forget the best. And also ensuring that with this project, we can nurture and have fellow adolescent girls and young women that can take this and replicate, but also that we will have stories and those experiences taught and shared to say, have you guys considered this? So that the young women themselves pave their narrative their way. Thank you.
Thank you, Barwani and Nissily. I think the work you have been able to accomplish, pleasure, positive, comprehensive sexuality education, is inspiring, and we are looking forward to what comes next. Our final presentation, absolutely not the least, comes from Sadia Rahman with a project School of Impossible.
Hello everyone, I'm Sadia Rahman and I am one of the winners of 2021 Ingenuity Fund winners from Bangladesh, and my project name is School of Impossible. So School of Impossible is an online platform where we are promoting SRHR and climate education through different creative mediums. Because we all know art is art is a universal language. Everyone can connect through arts. So in our platform, we are using storytelling, we are using songs, poetry, drama to reach youths and adolescents in climate vulnerable areas, mostly the coastal belts of Bangladesh, to disseminate information about climate education and SRHR. The situation in Bangladesh is really vulnerable, and many young people doesn't know how their SRHR lives are being impacted through climate change. So, for example, in a cyclone in 2007 named Cedar, significant amount of child marriage increased in Cedar affected areas. So the connection between a cyclone and child marriage was families that were impacted by Cedar thought when they couldn't afford their daily lives and they lost their jobs and they lost their harvesting lands, uh, they, they, the idea of getting the adolescent girl in the family married was more feasible to cut down the costs. So there are evidences where 13 years old, 14 years old girls are getting married due to these challenges. So that's how directly climate change and SRHR is connected in Bangladesh particularly. And also a recent study showed that adolescent girls in climate vulnerable area in Khulna, there's a division in coastal belt of Bangladesh, adolescent girls are taking oral pills, contraceptive pills, to stop their regular menstruation because they cannot afford sanitary pads at the first place, and they cannot. So they are used to use clothes during their periods, and due to increased salinity in the water, they cannot wash their clothes during menstruation. So they are choosing to stop their regular period so they don't have to wash their clothes in saline water, because they have this knowledge and information that if you wash the cloth in the saline water, you can get infection or it has harmful effects in your body. So these are some evidences, these are some stories from the ground that how vulnerable young people are. So through our project, we are working in 4 divisions of Bangladesh, coastal divisions mostly, Khulna division, Chittagong division, Borishal division, and Cox's Bazar. Recently, we have celebrated World Health Day and International Menstrual Hygiene Day. Both of the days were celebrated with in all of the coastal divisions of our project area, and also in Dhaka, because while working with our project, we have discovered there are a number of people who are being displaced due to climate change, and they are migrating in big cities of Bangladesh. So in Dhaka, there are more than few slums where these climate migrants are living, and suddenly their quality of life has dropped, and they are struggling to access education, to access a quality life, and access basic hygiene as well. So we have conducted basic training on menstrual hygiene management on the occasion of International Menstrual Hygiene Day. And this is one of the project focus, that we disseminate information around SRHR, and we work with the climate vulnerable and climate affected people. And also we are on the occasion of World Health Day, we actually had a drama where a group of people from this climate vulnerable climate migrants who are living in the slums, they have a small theater. So that theater performed in our program, and there is a story of a little girl who came to Dhaka and was having consequences due to this migration due to climate change. And also we are looking forward to develop a comic book that will have a basic storyline of a young person affected by climate change, and we're really looking forward to that. And currently all of our teams are actually disseminating trainings and information sessions among adolescents of different educational institutes regarding climate education, and also how young people can adapt climate through climate change, and also what can be their role from the community and the rural areas, so they can have a voice in a national platform. And also we are looking forward to organize Festival for Change in those coastal belts. So Festival for Change will be a place where we will bring together the community people, mostly adolescent and young people, policymakers, researchers, activists, and other civil society organizations and relevant stakeholders, where young people will have a platform, and they can have a dialogue with policymakers that how their lives are being affected through SIHR, and how they can actually overcome through these challenges, and how this climate change can be tackled. Because the scenario in Bangladesh currently, young people don't know how climate change are affecting them directly in their sexual and reproductive life. So we are currently disseminating those informations and helping them to identify their existing challenges, and also kind of giving them that platform where they can come and have this dialogue with the policymakers. Because if young people are not aware about their rights, they cannot actually claim them in front of the policymakers. So that's why this is our mission that we have started through this project. And thanks to Gates Institute for taking this great initiative to support young people so they can have these amazing works around the world, I would say, through this grant. So yeah, thank you.
Thank you, Sadia, for that presentation. The intersection of climate change and SRHR is such an important area, and I love how you have been able to address that intersection through arts. Really interesting. I would like to sincerely thank all of our panelists for their amazing presentations. I really enjoyed hearing about your project, and I'm excited to learn more as we jump into the question and answer. Just a reminder, if you would like to ask the panelists a question, please post it in the Q&A box. Hi, everyone, again, and I hope you can hear me and doing well. Amazing stuff. I have to just keep saying amazing and amazing again. And it's now time for question and answer. And just like we said earlier, feel free to post it. We already see some questions coming. Please keep them coming. We promise to take as many as we can within the time frame that we do have. And the first set of questions will go to Barwani and Nissily. How does pleasure positive comprehensive sexuality education differ from the traditional sexuality education that we all are mostly familiar with? Over to you, Barwani, and then Nissily, I'm sure you both would like to speak to this. Thank you.
Oh, hi, and thank you. So thank you for that question. What is the difference between pleasure positive and then the normal comprehensive sexuality education that we actually know about? So the angle where our project is coming from, the activities that we're having, is that in Malawi, I think also most of the cases in most of the communities in Africa, when you look at sex, but also most of the CSE, that we have the curriculums, usually they come from an angle of fear, saying, if you're going to have sex, you're going to get pregnant, you get STIs, or there's HIV, or it's not good. You know, it's such kind of a taboo. There's not that discussion of what is it, how can we make it better for the young girls? But then also our program, we're looking at these adolescent girls and young women who have already experienced sex. They have initiated sex, they already have children. They're already actually active in sex. How do we actually make it that the information that we're giving them, it's not coming from an angle of fear, it's not a taboo. it's there, it's part of life. How do you build the agency for them to know that I have the power, I can make a decision on how I want my sex life to be? So this is where we're saying, moving away from the traditional CSE, let's add that type of information, but also the way we are communicating about sex and sexuality to them. They need to understand their bodies, but also whereby they're getting in touch with their partners, how do they actually even negotiate the sex and what they want to get out of it. Thank you. Barwani, if you're online, would you want to jump in?
Barwani, are you there? Okay.
Yes, I can hear you.
I
think also, sure, go on. I think also with the pleasure of positive, what we're really looking at is, one, to be positive when you start talking about sex. So to change how we frame comprehensive sexuality education in a positive way, to say, so if you're a girl, the thing we got from all this conversation with young women or adolescent girls is it's always about your partner. It's never about you. It's like the sex, you're there, but it's like you're the conduit, but you're not there to enjoy it. And that takes away the informed position, the skills to make that decision around sex. So it removes the shame. So it's to frame things instead of saying, like I saw a comment in the session that talked about STI. So one of the things is that the pleasure positive also helps to say, we don't just look at sex or sexuality comprehensive education to say what prevents pregnancy, but also what prevents sexually transmitted infections, because it's like we're approaching sex from a problem thing, but we're saying, how do we make sex more empowering, more informed? So one, we're looking at what's the positivity, but also putting the young women and the adolescent girls and the young mothers in the middle. So I know we talk about right-based CSC, but now we're saying, why don't we ask the right questions to say, what would you want to know first? Are we skipping a step? But also thinking and being flexible in saying, sometimes we, like with the CSC, we're like, we want to give you these skills and this is how we're going to do it. But being able to understand somebody's story, where they are at that stage, and taking a step back to saying, how do you make the decisions? But also looking at issues around sex to say, they include sex, sexuality, and also relationships. Do we understand and making sure that that forms the best? But also making sex seem sexy. Because I think sometimes you're just like, use a condom because it will prevent A, B, and C. But how do we say, yes, you might feel less pleasure as a woman if you do this, but how do you initiate it with your partner to touch you this way? Because that will make sex more pleasurable, but that also helps you to have good well-being and movement. But that's also a good step in embracing learning, because now the learning is less about your partner, but more about how do you understand your body and yourself.
Absolutely.
So it's more like, how do you move forward to make that better?
I agree with you, Barwani, 100%. So safe sex, yes, but I tell you, it also should be pleasurable. And I'll just move to Simon. Simon, I know you worked with female sex workers. Did they express any particular challenges or barriers when it comes to access to the project that you were not expecting? So were there particular challenges or barriers? And I think in addition to that, Darlene had actually asked a question if there was an element of preventing sexual transmitted infections. So if you could just cap those two together in 3 minutes. Thank you, Simon.
Yeah, thank you. Thank you so much. Yeah, about the STIs, we really did not address STIs in this project. But I've had another project with sex workers where I did STI screening. Here, the only area where we came into when STI was concerned was those who accepted the IUD. Actually, there were very few of them who accepted the IUD. We had to screen them first for STI because an active STI like cervicitis is contraindicated for the insertion of an IUD or a pelvic inflammatory disease. So those are the things that we did And if they were present, we did not insert a method at that moment. But after treatment, they could still come back and get their methods. And unlike the barriers that you are mentioning, the sex workers, they are a very difficult group, very, very difficult group of people to work with. And getting them to come and get methods free of charge, they were like, if you are not going to pay our transport, we are not going to come there. So that was a barrier because we did not budget for transportation, but we had to pay their transport for them to get family planning methods, which was being given free of charge. Thank you.
Thank you so much for that response. And Maia, can you just tell us more about the long-term impact of youth-led and youth-centered model? I think this is very important. This is quite a youthful conversation we're having, and it will be important to just see what you think about the long-term impact of this.
Yes, so at Projet Jeune Leader here in Madagascar, we definitely believe that the person who's delivering CSE, and in our case, it's in schools with young adolescents, middle schools, government schools, and we really believe in the power of the messenger, the person who's actually delivering this information, making sure that they're not only a positive role model, that they're also embodying all of the positive aspects, as my colleagues have talked about, around CSC, that they are selected for their gender equitable values, their positive norms and attitudes towards sexuality and adolescent health and development. So we feel like this is definitely a core value for us at Projet Jeune Leader, and that is why we have these dedicated educators who are working in the public school system, young people 18 to 25 years old, as specialized CSE educators within government schools. So we definitely have trying to change the narrative around who delivers CSE. I think that traditionally, there's the idea of training teachers within the existing school system. So that might be a science teacher. It might be perhaps in some areas, if there is some sort of a civics education teacher, and building that person's capacity. And I think we're trying to change that dialogue. And that is one of the things we want to showcase through collaborative filmmaking, is to say, you know, there are other alternatives, and there are other alternatives that work, that are more appreciated by students themselves who are receiving this information, and then making sure that we're also mostly drawing in the community positive feedback around this new model, and then sharing it with national stakeholders as well as government officials.
Amazing. Thank you so much, Maia. And I say the prospect and also looking at the sustainability of this important and Ingenuity project as well. And Joshua, this question is for you. So being the first comprehensive program for sexual and reproductive health and rights, and FP, of course, education to young deaf people in Pakistan, did you face any unexpected barriers while you were going about your project? And if you don't mind adding this to it, is that were there particular strategy that you had applied in order to overcome those unexpected barriers? That question was actually asked by Gulam. Thank you for asking. Just keep your questions coming. Over to you, Joshua.
Yeah, hi everyone. I hope I'm audible. And first of all, thank you so much for having me here. And answering to your question, yes. First of all, it was quite new, and it's still going on, and it's quite new for us as well for the deaf and hard of hearing young people. Because when we conducted the workshop, it was very new for them, even for the teachers. There are some organizations in Pakistan who are working for their education, right? Who have developed and established schools for them, but no one is talking, even from the government side and even from the civil society side, for their reproductive health and rights and access to family planning, education, and services. So it was new, and the challenges which were quite unexpected. That it's quite hard. To having gathered all the hard of hearing young people and deaf people, because it's very difficult for them to trust others, because they have believed that there's space for in the society, and so we had to establish a strategy in which we reach them through the established who are working with them. And we try to convince the organization's heads that this is the project we're working on, and this is why we are implementing this project. So it was it took a bit longer time, which we didn't expect, but it went well, right? So this is the whole story. But the thing is that we also, got some unexpected positive response as well. Deaf and hard of hearing young people, they were quite energetic and passionate that yes, we accept that we do have a space in the society, and we really want to learn about other issues as well. Another unexpected thing happened with us, that as we, the other young people and other organizations, we conduct a workshop. Like in one day, we conduct 8 sessions, for example. And for the deaf youth, it's only 4 sessions. The pace of the work is a bit low as compared to other work. So we had to manage, and it's quite difficult for the sign language interpreters to translate the things and translate each word to be conveyed to the deaf and hard of hearing young people. So these were the challenges, but somehow we tackled, and we engaged the deaf and hard of hearing young people, and they are still with us. They are still engaged with us, and they share stories with us that, okay, this is the issues we are facing right now, and they seek guidance from us. So it was quite fruitful, and we are still implementing the project, and we are trying our best to support them and to scale up the project in Pakistan. And currently we don't have any particular strategy developed, because this is also new for us. But with the passage of time and with the collaboration of deaf and hard of hearing young people, we will definitely be developing a proper strategy to reach them and to work with them. Thank you.
Thank you so much, Joshua. That was brilliant. And to Sadia, it would be important to know the unexpected challenges you had to face with the project and how you were able to overcome it. And I think this is also linked to the question from Clement, asking to what extent there were loss or any damage in sexual and reproductive health and rights and services. So over to you, Sadia.
Thank you, Margaret. So I'd say the linkage between climate change and sexual and reproductive health and rights has a strong linkage. I'd say that because, for example, if there are heavy rain and one pregnant woman wants to access a service facility, she cannot do it. If there is flood and there are emergencies and adolescents cannot access information and services in adolescent health corner centers. And by the climate change, the number of disasters, incidents that's been taking place in, particularly if I'd say about Bangladesh, it affects our entire household, it affects our economical power as well. And every family is different, and every family gets impacted differently. For example, if a family has to migrate to a big city due to climate change, their entire system actually collapses, and they go through a trauma to adjust in that big city settings, and their quality of life actually drops. So and as I said in my previous section, that most of the adolescent and young girls are being the victim of climate change, and their SRH and particularly their right spots are being ignored. They cannot access basic human rights, which is SRH, through these changes. And I would say that the reason of climate change and the countries that has been involved in this process, they are not being impacted on the ground actually. Countries like Bangladesh, India, they are the actually sufferers. So I would say that the question was how much SRH has been singled out in the process. I would say SRH is something that is our fundamental of our lives. If our sexual and reproductive lives are not being tackled in a good way, if our body is not in a good position, and if you don't have any command over our body. The entire life is actually compromised. So I'd say it's affecting entirely our lives on the ground, especially the adolescent and young people's lives.
Absolutely, Sadia. Thank you so much for your response. And I would just go back again to Nissily and Barwani, while I also probably the last round of question, even as we hope that you can post your question on the Q&A box. So to Nissily and Barwani, there's actually a question from Rabiat Hassan Ahmed from Malawi, I guess, because she had said in Malawi, how you deal with cultural and social norms around sex and sexuality. And the question again is basically, have you encountered any challenges in reaching out to the adolescent girls? And I'm asking you both this, linking it up to the pleasure, the positive aspect of comprehensive sexuality education. We know we're still in the struggle of making sure CSE it's being adapted and implemented, of course, not throwing away the core component of it. So how has that been? Did you have to go through or maneuver any of this cultural and social norms? It would be good to share, and then we'll go to other speakers to ask about their most exciting outcomes from this Ingenuity project. Okay, we will start with Barwani and then Nissily. Thank you. Barwani, are you there?
Yes, I was just reading the question because it says loss and gain singled out, but I think you talked about cultural norms. So I think for our work, this is also where a local partnership and understanding where the linkages are, but also contextualizing it and being nuanced really, really matters when we're talking about sex and sexuality. Because we know that young people are having sex, and they will keep having sex. But where we come in is we all agree on something. So how do we move it? So I think for us is really we're working with a partner that already works with adolescent girls, but we're also working with a group of young women that are either pregnant or mothers. So one, you cannot deny that they're already having sex. They already have a child and they're more likely going to have a repeat pregnancy. But now we're saying, so we're here, but what are the lessons? How do we engage this and how do we break it? And one of the issues is they already, for example, go to antenatal clinic where you're dealing with somebody. How do we engage that the CSE, even the comprehensive counseling is better? So I think in this process, part of our work is also to work with the existing structures to understand that if we don't work with young women where they are, what does the life experience or the other experience already show us? And then how does intervening now help us later? But also using those examples of already young women who've been there but come back and show. Nissily, if you want to add something else, but thank you for the question.
Yeah, thank you, Barwani. Using examples of other women really works. Nissily, any addition from your head?
Thank you, Barwani. But I think Barwani has covered the answer to that question to say that understanding that our young women, adolescent girls, they don't come from a vacuum. They're coming from somewhere. They have structures. They have communities that support them where they're coming from. So like with our programming, one of our entry points is to work with the communities, the community leaders themselves, to actually even also understand from their communities, but also community leaders' perspectives, what is it that really the young women would actually, how is their life structured, their traditions, but also culturally, how would the program actually being built, the discussions built around their traditions and also their cultures as well. Thank you.
Thank you so much. And I see someone like Tom sharing his experience of working on CSE and how, you know, it looks like, oh, are you here to make people promiscuous or for whatever that word means and all of that. So it's really important to still re-emphasize the fact that adolescent girls do not exist in vacuum. They have communities, the intersections around them. And it's important to do proper community entry and see how we can get the community to support them and also understand the project. So thank you so very much for sharing that. So I would just move on to Simon, if you don't mind. What was the most exciting outcome of your project? You probably have shared a lot of outcomes or results. Which one would you say stood out the most, or maybe a wow moment while implementing this project? Thank you.
Okay, I just want to say that I'm still actually implementing my project. It has not yet gone to the end. Yeah, I'm even looking, the more interesting part of the project that to come will be the focus group discussion. Or we'll have two focus group discussions, one for the female sex workers who receive methods, long-term methods, and one for the peer leaders who were trained and served as agents of family planning. I think that is where the most interesting part of this project is going to come from. Then, so far, what was so interesting was that female sex workers are ready to use family planning if it is available. So with one of the things I'm already concluding on is that with adequate education and funding, female sex workers can use family planning. Thank you.
Thank you so much for sharing. And Joshua, would you like to tell us your most exciting outcome from your project? And again, this is still looking at Tom's question, and it can really go to any of the speakers, of the panelists rather. It's really to say, how do you ensure that, yes, you're speaking about CSC, and in some communities where you get pushback to say, oh, you're teaching young people to have sex, you're doing this and that. How do you still maintain somewhat good relationship? I mean, support of these community leaders. It could be in form of religious, traditional parents, in whichever way. At the same time, young people still are able to benefit from this project. So I would hand it over to Joshua.
Yeah, hi. So can I just can you repeat the question, because I think I missed some of the portion of the question. Sorry for that.
Oh, it's okay. So it's to your most exciting outcome from this project. And if you don't mind maybe speaking to how do you ensure that balance between getting community approval of comprehensive sexuality education or family planning for young people, as well as ensuring that those young people benefit from it.
Okay, perfect. So the first thing that outcome, as the process, first of all, the project is still going on, right? Until now, the outcomes were quite good. The first outcome was that we also collaborated with UNFPA Pakistan, which is an additional and unexpected outcome, and the partnership. They got interested in partnership with us, particularly for this project, and after the workshop, a lot of at least 10 foundations who are working for the deaf and hard of hearing young people. They tried to reach us. They reached us and they asked that, okay, you are conducting this workshop, and we also want to be a part of it, and do let us know whenever you organize any next event, and we will definitely be interested to be a part of it. And another thing also happened that so now we will be establishing a comic book, and we will be conducting the people will be people are in the storytelling session, people will be a part of it, and I believe that it will also be very productive, because we will be conducting different storytelling sessions in sign language in different cities of my province, right? We are focusing on and for CSC, in Pakistan, we unfortunately, we cannot talk about this term, and we cannot talk about sexuality elements and aspects in Pakistan. So which what we focus on is the life skill-based education components. We call it under the umbrella of life skill-based education, and we focus on different components of CSE under the umbrella of life skill-based education in Pakistan. So this is how we work, and still in most of the areas we cannot even talk about sex, we cannot even talk about sexuality, we cannot even talk about access to contraception. So preliminary, we initiate with some basic things and some things to which society can bear and which society can engulf, right? But in safe spaces and a specific number of people, we do talk about it because we have to educate young people. But still, such topics are taboo and stigmatized in Pakistan. And we, the SRHR and family planning advocates, are trying our best to educate people and give age-appropriate sexuality knowledge to young people, adolescents, and children. So I hope I have answered.
Absolutely, Joshua, thank you so much. And again, I think the one from the latter response is to talk about the language used. So at times, for example, in Nigeria, it's called Family Life and HIV/AIDS, but importantly is that we're ensuring that the messages are comprehensive enough to ensure young people have access to adequate and accurate information so they can make informed choices. So that's also where community ownership and also choosing the right language, either in your indigenous language or just using the right word, that helps ownership of CSE. And I see Maia already shared some resource, or one resource with us, so that we can check it up on how they were able to really gain community support for in-school comprehensive sexuality education. Do well to just check that out. And Maia, I'll just hand over to you to tell us something exciting, your most exciting outcome from the project. I know you've mentioned a couple of them, but what really stood out for you so far from the project, in case you're still implementing?
Yes, we are still implementing, you're correct. We're actually at the stage right now of going back to the communities where we filmed, where the educators filmed their own stories as CSE educators and narrating their experience in the community. So we're now going back to those communities. The educators themselves are going back to lead community screenings to basically get a second set of feedback and more qualitative information from the community on how they responded to the educators' perception of their role in the community. So that's happening as we speak now, which is very exciting. We're also excited because the collaborative filmmaking tool so far has really been used in Nepal. So that's where the tool has been tested and tried, of course, at the community level. So we're now hoping to have some new insights from using this in the Madagascar context, and also working with our partners at the University of Pittsburgh to hopefully create a global document about this tool that I think would be useful for other organizations who are looking to visually kind of send a new narrative, especially around complex topics like CSE, building community support, which just doesn't lend itself to a brief or a one-pager. It's changing that narrative and having something that's much more visual. So we're definitely using that already in our work as well, through the advocacy work with different representatives at the Ministry of Education, INGOs, to have these videos with this new narrative and use this as a discussion starting point around how do you create community level support through relationships, through new forms of engagement, coming from the voices of the educators themselves.
Amazing. Thank you so much for sharing. And I think in line with still CSE, DU has shared that in the Ministry of Youth here in Malawi, we have the How to School CSS curriculum, which is generic, but of course also tailored to different diversity of young people living with HIV. They're also the specific model on CSA and climate change, something close to what Sadia is doing. And then CSS for youth with disability, breaking the silence. And all of that and it's willing to collaborate. Thank you so much for sharing that. And on this note, thank you so much, our panelists. And it's important to know that thinking outside the box, and in most cases, I tell you, throwing away the box, you can see how we're able to step into new things, innovative and ingenuity ideas coming alive through wonderful young leaders. And at this point, we are at the end of our webinar. And I would like to once again thank all of you for attending. It's World Contraception Day, and it's so good to know that you are spending part of it with us, and particularly to talk about something really important, which is family planning for young people. If you would like to hear more about the journey of Ingenuity Fund winners, we invite you to watch their Candid Conversation podcast posted on the 120 under 40 site. So it's important to really look at that. We also invite you to share your contraceptive story in our video campaign by visiting 120 under 40 site. Thank you all, and do have a great rest of your day. Thank you so much. And just stay tuned. The next set of Ingenuity Fund winner will be announced at International Conference on Family Planning. I can wait. I hope you can wait too, but we look forward to that. Thank you so much to our amazing panelists. Thank you. And have a good evening, good afternoon, good morning, depending on which part of the globe that you are. Bye.